broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to our webinar, What Works for Third Grade Reading, Advancing the North Carolina Pathways to Grade Level Reading, Measures of Success in Your Community. We are very excited that you have chosen to spend some of your time this Monday morning with us. We're just at 11:30, so we will go ahead and get started. Today's webinar will cover the following areas. We're going to talk about what is Pathways and why did we develop these working papers, what's in them, how can the papers and other Pathways tools support community action, and we'll share some examples of how the papers are already being used. And of course, we will save time for questions at the end of our meeting. We are very fortunate to have quite a stellar group of presenters with us today. Our own Mandy Ableidinger, who is the Policy and Practice Leader at the North Carolina Early Childhood Foundation, and really the heart and soul of our Pathways work. Dr. Janice Gruendel, who is a senior fellow at the Institute for Child Success, and I'm sure many of you know her from her work across the country on early learning. She's a true national leader in our field. And Keller Ann Rubel, who is the Associate Director of the Institute for Child Success. And my name is Tracy Zimmerman, and I'm the Executive Director here at the NC Early Childhood Foundation. So I just wanted to, for a little housekeeping, just let you know that we will take questions. We'll address them at the end, but you can type your questions in the question box, and then we will be able to pose them with our presenters. So one of the things that I always like to do before getting started, because I have this huge fear that no one can actually hear me out there in the world, if someone would just type in the question box that you can hear us and things are working, that would be very much appreciated. Thank you. That always makes me happy. Sigh of relief. All right. So just as some background, the Pathways to Grade Level Reading is an initiative of the North Carolina Early Childhood Foundation in collaboration with NC Child and the North Carolina Partnership for Children and Best NC. And this work, What Works for Third Grade Reading, is actually really quite has been a very unique process. And so we've been very fortunate to work with truly stellar partners. Again, Best NC, who partners with us on Pathways, actually initiated this work some time ago and hired and contracted with the Institute for Child Success, and then said, hey, Foundation and Pathways, we want this to best suit and advance the work we're doing through the Pathways work. And so really let us lead the way in ensuring that that would happen. And that's quite a unique collaborative, I would say, to have happen in the early childhood space. So we're grateful to both Best NC for their willingness to really raise the funds, make this happen, and then let us run with it. And to certainly ICS, the Institute for Child Success, for the expertise that they brought to this process. So I am now going to turn it over to Mandy Ableidinger, who is going to give you a little bit of background on Pathways and how these working papers fit into our charge.
Great. Thanks, Tracy, and hi, everybody out there. Thanks for joining us today. So Pathways started in 2015 when the foundation pulled together a diverse group of leaders, and this is people working across disciplines, so people from health, from family and community support, from early learning and education, across different sectors, people from government, policy, private, nonprofit, and across our systems in our state, so both birth to 5 and kindergarten through third grade, and across the political aisle, to really ask them if we needed a conversation in our state about a whole child birth to 8 approach to improving North Carolina's third grade reading proficiency. Yeah. So the answer to that was, well, first we'll say we know that third grade reading is very predictive of future outcomes. We know that kids who aren't reading on grade level by the end of third grade are actually 4 times less likely to graduate from high school. So the answer to our question was a resounding yes. And so our work is really focused on this shared vision that all North Carolina children, regardless of their race, their ethnicity, their socioeconomic status, are reading on grade level by the end of third grade, and that all children with disabilities have communication skills commensurate with their developmental ages so that they all have the greatest opportunity for life success. So Pathways is an early literacy initiative. And it is also holding up early literacy as a proxy for child well-being. We know that across the spectrum of health and education and family and community, if the pieces are in place to support children reading at grade level by the end of third grade, then the pieces are also there to really support their healthy child and family development overall. Really key to the Pathways work are a whole set of principles that the group came up with. I wanted to highlight just 2 of those today because they're really important. One is equity. We have an equity lens that's infused throughout the process, from who is in the room to how we're looking at data disaggregated to ensuring that the strategies chosen at the end of the process are ones that will decrease disparities and increase equity. And then a second principle that was really important, and I just wanted to highlight today, is ensuring that parent feedback and community provider voices are heard throughout the process. So we have processes in place to make sure that that happens. So the Pathways work has really had 3 phases. In the first, we asked what should we collectively measure to really ensure that our children are on the pathway to grade level reading. We pulled together 30 data experts who worked for 4 months, partnering with more than 100 Pathways stakeholders to really understand the research behind what moves third grade reading outcomes, and then to create a framework of measures that we should all be tracking. And there were some criteria around those measures. We wanted to ensure they were research-based, that they were actionable, they were impactful, that they were easily communicated, and that they decreased inequities. So they came up with a framework, and that really serves as the foundation for Pathways. This image is part of the framework. The full framework is available on our website. You can see the link there. Of course, the framework does not include everything that impacts grade level reading. In the second phase of the work, we really asked the question, how is North Carolina doing on those measures? You know, what should we prioritize as a state to move forward on first? So we pulled together learning teams of experts in the different sectors that I was mentioning before, health and family and community and birth to 8 education, and really looked at the disaggregated North Carolina data behind the measures. And that group recommended, based on both the overall need in the state, but also disparities among different groups of children, where we as a state should move to action first. And you can see those areas represented here. Since we're doing a quick overview, we won't go into the details on those. And then in phase 3 is what we're working on now. So now that we know what we want to measure and where we need to focus as a state, what should we do? What are our strategies for action moving forward? So we have design teams that are tasked with really identifying those strategies that would realize change on our prioritized measures. They're being asked what are the policies, the practices, and the capacities that need to be changed in North Carolina to move us toward our vision of all children reading on grade level by the end of third grade. And that is where the working papers come in. They really provide the research and the evidence-based policy, practice, and capacity building options that the design teams can consider as they start to create their agendas for change in their prioritized areas of focus. We are, of course, delighted to find that they are useful in a much broader context as well, and that's what we're going to be talking more with Janice and Kelleran about today.
Thank you, Mandy. That was a great overview, and we encourage folks to check out our website to learn more about the Pathways work. Before now moving towards digging a bit deeper into these working papers, I also want to make sure I share that not only was the process of developing them quite collaborative, so was the process of funding them. And so I want to make sure that we acknowledge and thank the Duke Endowment, the Weiner Family Foundation, and the Child Trust Foundation, who provided Best NC with funding to move forward with these papers. And so you can see collaboration is truly at the heart of all of these. So we are going to now switch gears and move into more of an interview format so that we can learn more about what's in the papers themselves. So I'm going to turn it over to Mandy and Janice to dig into that.
Great, thank you. So Janice, we know that the general structure of these papers is the same. So in order to make them easy to understand and use, each working paper details why the pathways measure matters for third grade reading, outlines how it's connected to the other pathways measures of success, defines some relevant terms that we all need to be on the same page about, and then offers national research-based options that can impact the measure, including policies and practices and programs and capacity building options. So help us understand a little bit what we mean when we say policies, practices, programs, and capacity building options, since those terms can mean different things to different people.
Thank you. This is Janice, and indeed, it turns out that they do, which was one of the discoveries we made as we worked our way through the 12 measures of success that we were looking at. So let me just talk briefly about each one of those and give you a little bit of an example that helps us to discriminate one from the other. So policies are generally statements of purpose, vision, or action that are codified in law or regulation or some other administrative document, usually at a governmental level, although they can certainly operate in other kinds of organizations. They can be at the 50,000 foot level. They are often, but not always, linked to budgets. So let me give you two examples. Here's a 50,000 foot example. One state, our state in Connecticut, so I'm from Connecticut, has a policy of using a two-generation framework in its work so that we are sure that we reach children and their parents. This particular framework, which you know the Aspen Institute Ascend at the Aspen Institute is really the primary mover on, although certainly not the only one. It was codified in Connecticut in legislation. It is operationalized through an interagency council, and it has funding. So that's a 50,000 foot example of a policy. And in our state, it's 2Gen. Here's a 5,000 foot example, and I'm going to work my way down to the grassroots level where we all work. So as a 5,000 foot example, we learned in doing the pathways work that North Carolina has a policy to specifically address maternal mental health, and most specifically maternal depression. And we learned that as a basis of the policy, North Carolina funds several, I believe it's 5, but don't hold me to that, it's 4 or 5, maternal depression screens during a baby's first year for Medicaid enrolled moms. So that's a policy. The policy is really focusing in on and assuring that we can create a positive mental health environment for children and their moms. So that's a 5,000 foot example, but they are both policies. So now let me shift to practices. Practices are really the protocols, the strategies, and the actions that we use to implement policy, to conduct our engagement with families, and to do our work in general. So as a practice, let me use a practice example. We use a set of assessment and screens to identify maternal depression. That would be a practice, and it flows from the policy of assuring that we have strong, positive maternal mental health during the critical period of prenatally through the first year. Here's another practice example. As a practitioner in child welfare, where I've spent a lot of years, we use a strength and risk assessments to figure out when, in fact, we engage in the process of supporting families versus removing children. That's a practice. Another example of that would be using child and family teaming. That's a practice, and we use that to guide the engagement that we have with the families that we're working with. Those are practices. Sometimes they stem from policy, and other times they don't. Programs are the specific formal services and interventions we use to prevent, support, treat, and remediate when we engage with families or children or whoever are our consumers. Using the issue of maternal mental health, here's an example, a 500 foot example. So lots of states who have a policy that says we want moms to be mentally healthy because it's important for them and their children. We want you to use certain set of screens, and there are lots of them out there, and no coherence necessarily. And then when you find something, we want you to do something. So an example of an evidence-based program, which would be reflective of the kind of programs we described, would be trauma-based or trauma-informed cognitive behavioral therapy. So we can go from a policy of improving mental health to the kinds of practices that we use to engage with families and using the tools, and then down to an actual program that is proven to create the outcomes that we want. And then the capacity issue is kind of one of those that runs around this whole array. And these are really skills, knowledge, administrative supports that we use to do the work we do every single day. They could be described as having data capacity, professional development capacity. We could talk about them in terms of our clients' executive function capacity. We could talk about the professional capacity to recognize implicit bias in our decision making. These are all capacity issues that you may find in parts of the pathways indication. Capacity can be internal or external to an individual or a group or an organization. So these are the definitions that evolved, informed by the science that we used, but also used to sort out what actually went in the papers that we could share with you.
Great, thank you, Janice. That's really helpful. And just as a reminder, feel free to type questions into the question bar if you have questions as Janice goes through. So the papers really lay out those research-based policies and practices and program and capacity building options very clearly. And it seems that states and communities and organizations, individuals might be really excited to kind of take these and run with them. So are there any caveats that people should have in mind as they're using these papers? What is important for us all to keep in mind as communities are using these to inform their work?
Yeah, thanks, Mandy. That's a really important question. Could I just say that the other point that I wanted to make under the policy piece is that we created, and Mandy and Tracy were awesome in doing this, having sort of participated and watched our information and knowledge building process. There's a first working paper, and it talks about what we mean by policy, what we mean by practice, and some of the challenges that we faced in sorting through this massive amount of scientific and research literature. So when you're using the Pathways working papers, please read the first one first, at least once. So now to Mandy's question of caveats. Are there caveats? You bet there are. Here are a couple. The first is that the knowledge that we derive, all of us, that we derived as part of this process from research, from evaluation, and from science is changing incredibly rapidly. You all know that. Since we wrote and published the working papers, new information on exactly the same topics has already been published. So that's a caveat, that what you see in print is what was when we found it and when we wrote it and when we published it. So the caveat is when you're using this material, be smart and go back and make sure that there isn't some other important piece that has since been published. Here's a related one. If we use this conservative approach, which is what I just suggested, and it makes us too cautious, then we end up waiting for 100% answer or a silver bullet in terms of policy, practice, or program, and we get almost nothing done. And improvement will be stalled. So the first caveat is be smart. The second caveat is be smart, but move forward. A third caveat that we found, and I'm going to underline a statement that I just made, there are very few silver bullets in our work. The work on supporting children and families in a community context, in an inequity context, in a state and federal or local policy context is such that we're looking for a single answer or a single evidence-based program, and the work is complex and there are very few silver bullets. Some of the most important thinkers in this field are telling us that what we should be looking for is not one program that turns the world, but a series of programs that we bundle together because vulnerable families have lots of needs, and that we look for cumulative impact that may be small and individually may look small, but in its aggregate can actually help us tip around the corner or turn the curve. So that's the third one. No silver bullets, small cumulative improvements. And then a couple more really quickly. Community context matters. What feels right in one community is going to be a political challenge in another community. Specific outcomes really matter. Some evidence-based programs look like they provide a range of outcomes, and yet when you actually dig into the gateway sites that rate them, you find that this particular program is really good for X, but it's not so good for Y. So you have to figure the outcomes and link them up to the programs you're looking for. Data matters. Data matters. I could say that 16 times. And then for me, the last caveat is making sure that your goal matches to the outcomes that are likely to result from these choices that you make. Having said all that, this is an unbelievable body of knowledge, and it's going to save you a bajillion hours. So starting with it is a very good thing.
Great. Thank you, Janice. And that actually is a really good transition to my last question for you, which is, we know you've been going around the country talking with all kinds of different people about these papers and getting their reactions. And I know in a few minutes, you and Kellerann are going to tell us more about how some communities have actually used the working papers to inform their work. But just talk to us for a minute about what's kind of unique about these working papers. What have we added to the field with the publication of these?
Sure. 4 quick points here. One is that the process that this set of publications was anchored, continues to be anchored in the collective data-driven analytic process is huge. It's just huge. It's grounded right, and it gives us confidence that what we're reading is not only valid from the perspective of the material that we summarize, but that it's going to be useful and has been validated by a whole group of people in almost any community we use it. So that's amazing. The second, and Kellerann and Mandy and I can all tell you this, we thought this was going to be a project, just a project. And it ended up being a labor of love, hundreds and hundreds of pages, more than 2,000 sites. So the sheer magnitude of working through the 12 indicator briefs is enormous. And as I said before, it's going to save you and other folks an enormous amount of time. The third for me, as I talk about this across the country, is that it was so smart to start with a national benchmark that everybody cares about, 3rd grade reading, but to not just talk about 3rd grade reading, to understand it within a framework that says from preconceptual health to sitting at the end of your 3rd grade state assessment test is a complex, rich, and developmentally changing process. That's huge because it doesn't let us kind of think we have a silver bullet answer, and it makes it very relevant to where everyone is. And then lastly, and Kellerann and I will share this, there's enormous flexibility in how you use the whole body of work or any individual one of these or even pieces within them. So we'll talk about that next.
Great. Thanks a lot, Janice. And I'm going to hand it back to Tracy for the next section.
Yes, thank you so much, Janice and Mandy. The amount of work that both of you did and that Janice did in the research here is truly astounding. We're going to switch gears slightly to talk about how might a community think about these working papers as a tool of, among other tools within the Pathways toolbox, if you will, to begin to have these conversations either within an organization, it could happen within an agency, it could happen across a couple of agencies and organizations, or community-wide. So we would posit that you would want to start first before necessarily with the papers, really getting a sense of how can we align with the measures of success from Pathways. What particular piece might we be advancing? And so, for example, you might be an organization that works in a particular area. Perhaps you work on something around early intervention. Are there pieces that you can align around the outcomes to help advance collectively our progress on the Pathways measures of success? So I think the first starting point is to look at what is our work and how can we align our outcomes with the Pathways work? Because the point of the measures framework, again, is to have a shared set of measures that we can use both at the state level and the local level to really drive large-scale population level change. The next tool I want to highlight for you is also then provides some more background on that work. This document, which there's a link on the slide, gives you all the background on what was the research basis for the measures and the influencers that were chosen. And so just as Mandy noted that we certainly didn't cover everything that moves the needle on third grade reading, we also clearly didn't cover everything that might impact health and development, for example. And so there were a set of criteria that our data action team looked at, and one of them being that there was a connection to early literacy within each of those. So this document gives you the research background for that and can help start a process to determine, particularly if you're bringing together a cross-sector collaborative group, where might we start? Where should we move to action first? How are we doing? So the next tool that you might find useful is what kind of data is available. When we did the work with the data action team, we were very intentional about not limiting them to only considering outcomes for which we had data available. I think we can all say with certainty that just because we measure it doesn't mean we should be, and just because we're not measuring it doesn't mean we shouldn't be. And so they were really guided by what were the most important things to understand about young children. And so the first link that we have here does share with you what data is available and how it is available. So that picture is just a snapshot. It goes through all of the measures to let you know what currently exists. We also have on our homepage a list of data sources, so that may be helpful to you as you look for community data. And we are hugely excited that in 2018, we will be launching a Pathways data dashboard. Excuse me one moment. SAS has been an incredibly generous partner and is developing this data dashboard with us, and we will be piloting it in early 2018 and hope to have it fully available in the spring. So those are some tools that are currently and will be coming to be available. The other tools we have is that it's also important to understand that we've found it very important to understand what is it that communities are already saying in terms of policy, practice, and capacities around the pathways measures. And so one piece that we just completed were a set of conversations in 14 communities across the state. They're highlighted in the map to get a better sense of what is it that supports those who are working with children birth to 8 in helping to achieve these measures, and what really gets in the way. And so we're in the process of aggregating that data, and we'll be making that available to folks across the state. And so that's another good starting point for conversations and ideas and things that you might look at in your community to say, yeah, this is something that we're also struggling with and might want to think about advancing. Similarly, we have held up as a principal parent voice, and I am truly thrilled that we will, by the end of this year, have a new report to share with everyone that aggregates what parents in North Carolina have to say about a number of health and development, family and community, and high quality learning environment issues. And so we have done a meta-analysis that summarizes really the high-level themes from 18 parent surveys, focus groups, and meeting groups. We worked with the evaluation group on this report. And the themes that came out of that have been aligned, again, with the pathways measures of success. And we think this can really serve as a powerful starting point for more in-depth conversations with parents and help guide communities and organizations as they think about being ensured they're being responsive to and engaging with parents in their communities. So that brings us to the working papers and how did they fit in? They are a tremendous resource on so many levels. And within the context of pathways, once you've thought about where is it that we in our community might want to act, or we within our organization might want to think about aligning work, they are a great tool to look at. One, what are we already doing? You'll note that as you read through some of these, that it could be that your community or the state may already be doing some of these things, because we were very clear about holding up what would be the research overall, and then we can take a look at using that against what our own policies and practices are. And they can provide, again, a framework for what could we be doing. And to emphasize Janice's point, what makes sense within our community, what makes sense within what our parents are telling us. And so they provide that kind of background. I want to emphasize again, Janice and I think Mandy both made this point, that all of Pathways has been very intentional about taking a birth to 8 whole child integrated and aligned approach, which means as much as we wish there was a silver bullet, if there was, we'd all have found it and we would be moving on to some other problem. There is not. And the research is very clear that there is no one intervention that will solve this issue at the population level, that rather it truly is a bundle of integrated and aligned interventions. So as you look at these, know that it's really about thinking what works within your community and within the areas that you've identified are where you need to really act first. I'm truly thrilled that we are going to be presenting, doing a whole pre-conference workshop at the 2018 National Smart Start Conference on this piece. How does a community engage in a pathways-like process? How do we build strong cross-sector collaboratives that span birth to 8 systems? How do we use that as a way to really build buy-in and ownership for the work, and to really understand where the needs are and what the best solutions are? So we will be developing a more robust framework of tools to work with and support communities that are wanting to think about this at the community level. And we will also then, following that, because as Mandy mentioned, we're in the design team process coming out with specific agendas, that will be another tool that communities can look at and use to say, is there a local component to this that I need to be thinking about? So with that, I'm going to pause. Again, there aren't any questions, so that means we're either being really clear or so muddy that no one can figure out what to ask. I'm going to assume it's the latter, the former. I'm confusing myself. So please remember, you can type your questions in the question box. We're going to shift gears and now go a little more into how communities are in fact using these. And so Keller-Ann Rubel from the Institute for Child Success and Janice Gruendel will talk about what they're seeing as they've developed these tools and do work with communities.
Thank you so much, Tracy, and hello, everybody. First, thank you so much to the North Carolina Early Childhood Foundation for facilitating this process. They've been an incredible partner and leader in the state, and it's been an honor to work with both Tracy and Mandy throughout this process. And thank you, too, to our major funders of this, the Duke Endowment, Best NC, and the Weiner Family Foundation. The process of writing these papers for Janice and I really helped to identify that the research, evidence, and information we compiled can really be a flexible tool for organizations, for governments, various community initiatives that are aiming to improve their child and family outcomes and community systems. And ICS, we are currently using this information to help guide other communities in our technical assistance efforts to reach those goals, and really rooting the community goals in evidence-based research. And so we're doing that through distilling the content of these pathways papers based on the community needs. And so we'll just walk through a few examples that ICS is doing. So Tracy, you can hit the next slide. So first, Janice wrote a paper for the Center for the Study of Social Policy. It is currently in draft on how child welfare professionals can use the Pathways briefs to address racial equity concerns and disparities. As Mandy mentioned earlier, racial equity is very important to the overall Pathways process, and there are references throughout the Pathways working papers that pulls out opportunities for racial equity impact assessments or attention to racial equity concerns. And we know this is important because if interventions aren't considering an equity lens to understand how different contexts, barriers, and conditions that affect certain populations, if they're not considering that in their interventions, then those interventions may not be as effective or targeted as they would like. So this paper really just centers that around child welfare in general. And we're excited for future opportunities and the Pathways design team process to really unpack health equity, racial equity, and access concerns and opportunities for North Carolina. So next slide. In addition, ICS is working with Bridgeport, Connecticut, in the Bridgeport Prospers collective impact process. It is a cradle to career system of supports broken into different age groups. We helped cultivate a Fact to Act 2-pager series that focuses on the 0 to 2 and 3 to 5 group age range. And these papers are really distilling the high-level metrics that Bridgeport has, the evidence to support interventions as outlined in the Pathways working papers, and then how that evidence can be applied to the Bridgeport context. And we've seen that these are incredibly helpful, they're digestible, and they're easily used to inform the interventions and the overall process. And so Janice can now speak briefly about how these Fact to Act papers are informing the implementation of the Bridgeport Prospers interventions.
So you could advance the slide, please. We get the next, yeah, thank you. So this is an amazing, I'm standing here smiling because it's a very heart engaging as well as mind process, that is an intellectual process, in moving from a massive amount of information to a summarization of the information, which is the Fact to Act work added by other measures that the community needed. Taking a piece of data that we saw, and I'll tell you what the data point is, it's that 3/4 of the kids who enter Head Start, which is a good proxy for all kids in the city of Bridgeport, are not where they should be developmentally. So they are substantively behind at the age of 3. We never had that information. It does relate to school readiness and 3rd grade reading, so it was a perfect spot. The data was so stunning that our collective impact process decided, holy smokes, this is where we need to start. So we have built what we call a Healthy and Ready by 3 playbook, which outlines 5 strategies that this community will engage in to advance and measure the readiness of children, age-appropriate readiness of children at the age of 3. Look, every child, in fact, every child born starting next year. So it's population-based, cohort-based, longitudinal over time, and it is causing us to engage with lots of the systems that are in the lives of families and with parents that in our case need help to move that. So this is a document, I'm really glad to share this, but it takes us then from Pathways to Fact to Act and into one domain of work which we can measure outcomes, and that's our Kids Ready by 3. Actually, I just presented that to the HRSA folks nationally in their learning network. So I know we're in a really good space here. And this Pathways to FACTA Act to a focus on this age range, I think has national importance. Could you do the next slide, please? Could we advance me? This is a very different example. Whoops.
Yeah. Sorry,
thank you.
Delay on the
That's okay.
slides.
No problem. So I've been privileged to work with colleagues in Eagle County, Colorado, which is where Vail is located, and the rest of the county. They are taking a 2-gen approach to their health and human services. And so it's not specifically geared towards little kids, but it's a way to rethink our practice in the context of 2-generation work going on nationally. We looked at practice issues and policy issues, and then it occurred to us we should go back to pathways and see what we could pull from the science and the research specific to Ready at 3, which we picked up from Bridgeport, Reading at 3rd, which we took from Pathways, and then the 2-gen opportunities that exist right here in Eagle. So we have been training on the neuroscience, training on 2-gen, and this last piece we've just done, which ties it all together using Pathways as a primary goal in the sense of 3rd grade reading, but also a lens to look at our other work. So that's a very different kind of example, but one that looks like it has really good legs. You can advance, please.
Thanks. And from the success of the Bridgeport 2-pagers, ICS is now working with other communities and various initiatives to develop 2-page summaries, memos, and different materials using the community's identified needs and the research outlined in the Pathways working papers to really help further along these community initiatives. When communities start with comprehensive evidence-based understanding of issues of early childhood systems considerations and use data of where the community is now, they can really create good, strong interventions. So the next step for ICS is to unpack how we can use the compiled research for different audiences. So we think that these can be a really powerful and flexible tool for funders, for policymakers, for advocacy groups, and like we're already seeing with Pathways, with Bridgeport, and in Spartanburg, South Carolina, how collective action groups and community initiatives can really use these to drive good implementation of programs, interventions, and policies, and various capacity building supports. One thing that we're keeping an eye on is that it's really important for policymakers to understand how evidence-based decision-making and interventions can really drive outcomes. At the federal level, we're seeing that it's often hard to assess the full broad impact of early childhood investments. At the federal level, legislation is scored by the Congressional Budget Office for its economic impact. So unfortunately for early childhood initiatives, these scores are usually only 5 to 10 years out, and they often don't account for the reductions in the future health, social safety net supports, education spending that we see by investing early. So the strong returns on investment from early childhood are broad across sectors, but often unaccounted for in legislative scoring. So policymakers don't really get the full impact of the legislation that they're voting on. So we're hoping that from a policy perspective, that the information and evidence that we've gleaned and put together in these working papers can really be a powerful tool for them to help understand and really drive home that early childhood investments don't just improve outcomes for kids and families now, but that it is broad and long-term and really help lift communities up and spur a lot of economic growth and impact. So the final challenge for us is that the wealth of information is just so broad. It's across the health sectors, it's across education, it's across family and community supports. And they're so intricately linked. So how do we effectively distill this information, create those links to the systems. And so we know that the Pathways data portal and other resources that they are creating are going to be so important to the future work and help other communities, other states really understand how community-driven approaches can be really powerful for the community itself and for the children and families that live in those communities. So we've got a few next steps that we've identified and are using to drive this work further. And, you know, we just finally, in closing, just want to thank the North Carolina Early Childhood Foundation for coordinating and directing this great body of work. We're so looking forward to the outcomes and the process of, and the decisions that will be made by the design teams, and to see all the great work that North Carolina is doing through the Pathways process. So thank you so much, Mandy and Tracy.
Thank you.
Mandy and Tracy, this is Jen. Could I just add 3 quick points to that strike me as we go through this? I'll make them very quickly. The first, that was a learning for us in doing the Pathways gathering and analytics, but has also been a learning for Keller Ann and I as we, you know, work on the ground using these. There are 3. The first is that the struggle with ourselves and the people we work with to understand the difference between evidence-based and evidence-informed. If evidence-based means in your mind random controlled trial, then the number of program opportunities you have to work with will be less, because that's hard and expensive work. So we found that we had to give ourselves a little bit of room very carefully in that, what is evidence, what is evidence-based versus evidence-informed. You will have the same issues no matter how you use this. A second one is this incredibly interesting tension, poignant sometimes, between evidence-anchored work and innovation, for which there isn't any evidence yet. And while we want to tilt towards evidence, we don't want to shut out the opportunity for innovation, because that's what eventually generates evidence. And there is a palpable tension in that at the community level, and one that's important to talk about. And the last one is, maybe for me, is the most important. I have found it so much easier to have conversations about issues of equity and justice when we were through the Pathways material, because where we found those issues in terms of disproportionality of data, we cited them. We didn't do a brief that talked about racial equity or inequity or justice or any of that, but they are spread out. And as Mandy said in the beginning, the issue of equity was hugely important to us. I found using the briefs and our extensions of the briefs an amazing way to have the conversations that we really need to have at the community and at the state level in a way that is non-threatening and likely to produce changes in the way we do practice. Thank you for letting me just get those last 3 points in.
Thank you, Janice. Those are important points to make. So thank you for calling them out. We are now going to take questions from folks. Just as a reminder, you can type your question in the question box and we will address them here. We have one so far, which is, excuse me, are there plans to make similar FACT-to-ACT community-based 2-pagers for North Carolina? Is that something NCECF will take on? And so for us, and where we're looking to go with this, is that as we go through the Pathways design team process, and their ultimate product is to develop policy, practice, and capacity agendas to move the needle on these prioritized measures, those will in fact become our sort of briefer versions, if you will, of where folks are recommending we in the state go. So while we're not looking to develop at this point ones for North Carolina in that vein, we will continue to look at it as we build out what are now, I think, more than 150 plus partners who are engaged in Pathways ultimately recommend, which will be a subset of certainly what's in here, as well as perhaps some other knowledge and data they are collecting. Are there other questions from folks? Again, you can go ahead and type those in the question box. Okay. I'm not seeing any new ones as of yet. Again, all of the papers are posted on our website. I think one of the other points I'd like to address is that Janice rightly pointed out that these papers capture a moment in time in terms of the knowledge that was available then. And as we know, things are advancing very quickly in terms of science and as it relates to young children. So we are in the process of actually redoing our website, where we will continue to update from a content perspective online what we're learning in the various pathways, measures of success. So there will be a mechanism to continue to access the most relevant information available.
Love playful.
So I'm not seeing any questions, so I'm going to, again, look at that as, wow, we did a fantastic job explaining the papers and some of the other tools available. Again, this webinar has been recorded. You will receive a link to the recording, and we will post that as well. If additional questions come up for you after you have had a moment to process, please feel free to reach out to us. We're happy to answer them. And we thank you for joining us today. Have a great day.